Hello, my name is Nabosa Yvonne Pauline, and today we're going to talk about tuberculosis, also known as TB, particularly ending TB as a global effort. Know the facts, save a life. Don't forget to like and subscribe for more health content. Today, we're going to focus on what tuberculosis is, the causes of tuberculosis, how does it spread, how to prevent the spread, and finally, treatment and management of tuberculosis. What is tuberculosis? This is an infectious disease caused by bacterium Mycobacterium tuberculosis. It is anaerobic bacteria, meaning that it cannot survive in oxygen-deficient parts of the body. It typically affects the lungs but can spread to other parts of the body such as the brain, kidneys, and spine. It has been noted that about a quarter of the global population is estimated to have been infected by the tuberculosis bacteria, though about 5 to 10% of the infected will eventually get the symptoms and develop tuberculosis disease, meaning that every 1 in 4 people are actually infected by the tuberculosis bacteria. There are different types of TB, and these include pulmonary TB disease, extrapulmonary TB disease, miliary TB disease, TB meningitis, and finally, drug-resistant TB disease. When one is infected, he or she may have the latent TB infection while one does not experience symptoms of disease. Due to a number of factors, this latent TB may actually be activated into the tuberculosis disease. And these factors include a weakened immune system due to conditions such as HIV/AIDS, diabetes, malnutrition, and use of immunosuppressant drugs. Spending much time in close contact with people having the active TB, especially in overcrowded or poorly ventilated environment, also increases the chances of you contracting the TB disease. Poor sanitation is another factor risking the lives of people. Not leaving out age as a factor, where we have the elderly, infants, and young children who have a weak immune system, making them susceptible to the tuberculosis disease. Among those factors, we also have substance abuse, that is, drug and alcohol abuse, that weakens the immune system of the individuals, therefore risking their lives. What are the signs and symptoms of TB? Generally, the signs and symptoms include persistent cough, chest pain, fatigue, weight loss, fever, night sweats, loss of appetite, and chills, though they differ depending on which body part is affected. For some cases, it can cause blood in urine if the kidney is affected and back pain with stiffness in the spine. How is it spread? It is spread through air when infected people cough, sneeze, or talk. And you might be asking yourself, how do we prevent the spread? Well, some of the ways of controlling the spread include covering your nose and mouth, proper ventilation, good hygiene, avoiding close contact with infected individuals, follow treatment, isolation, get tested, and vaccination with the BCG vaccine that is available in most countries. Lastly, we're going to look at treatment and management of tuberculosis. Treatment is through medication, which includes the first-line drugs and second-line drugs. The first-line drugs being for the non-drug resistant TB, and the second-line drugs being for the drug-resistant TB. Medication for the first-line drugs may take about 6 months, which may involve an intensive phase with fewer drugs, while medication for the second-line drugs is more complex and takes a longer duration. Management of TB includes directly observed therapy, which is the DOT, monitoring of the infected individuals that are on medication, isolating, especially those with the pulmonary TB, supportive care, education, contact tracing, and consulting healthcare professionals. Symptoms are identified. Thank you for joining us in the global fight against tuberculosis, which is a preventable and curable disease. Remember that early detection is key. Let us create a TB-free community. Together, we can stop the spread of TB. Thank you for watching. Have a healthy day.